please? Dr. Layla McCay is the director at the NHS Confederation, that represents health and care leaders. Thank you for joining us this afternoon. We're talking really about the balance between COVID, those who are suffering that, and other patients. And are we getting that balance right now?
Well, it's incredibly challenging, isn't it? Because we've always known that this was something of a trade-off. In order to get the NHS ready for the deluge of COVID-19 patients that we were preparing to accept, we were required to see various services being paused or reduced to make that capacity. It was incredibly important to do that, but now we find ourselves in this challenging situation where we absolutely want to bring back these services, but there are also lots of challenges to doing that. There's lots of capacity challenges, and as we try to bring them back online, demand is increasing and increasing, not just the usual demand that would come from people who were needing care, but additional demand for people who are recovering from COVID-19 and needing rehabilitation.
Yeah, but demand too from people who are getting increasingly more ill, if you like, particularly cancer patients, as we heard there. Many who are saying, well, I don't want to bother the NHS at the moment because I'm not sure how badly ill I am, and maybe leaving things too late.
Absolutely. We're hearing from our members across hospital CEOs, primary care, community care, mental health. People are very anxious that patients are sitting at home thinking, gosh, I'd better not bother the doctor about this. And that is going to, of course, lead to more demand later on and potentially people coming in at a more serious stage of their disease. So certainly there's a lot of concerns here. It's a very complicated picture.
Doctor, is this about money, or is this about allocation? Or I mean, it's rotas. It's getting people in the right place at the right time. We need to go back to that, don't we?
It's about a lot of things. We already had a waiting list round about 4.2 million. And from what I understand, that tends to increase every month, round about 1.6 million people. Now, if those people are not being able to access the care as they usually would, because some of the services have been paused to deal with the COVID-19 crisis, then those people are being added and added to that waiting list. And in addition, others are being added. And we need to look at this in the context. It's not just a matter of switching back on services. So if you think about it, for example, all health services are having to do social distancing, which reduces the capacity within the healthcare setting to treat people. We start to think about we can't use up all the capacity because we know, we're repeatedly told that a second wave of COVID-19 is a real risk and it's something that they have to prepare for. Plus, we have here staff who are exhausted, and even particular issues, like, for example, our members have quite often told us recently that they're anxious about setting up some of their old services, bringing them back, because actually they're not completely sure they're going to have the PPE they need to deliver those services. People are having to be looked after in different areas of the hospital, depending on whether they have COVID-19 or whether they don't have COVID-19. There's a lot of complications here, and they're all adding up to make bringing all the services back online pretty tricky.
Yeah, I mean, God forbid there's a second wave, but we're talking also about that period, the autumn and the winter, where those lists get greater anyway. People, they're affected by sickness.
Absolutely, that's a real concern. We know that this isn't a situation where things might just tail off. Actually, demand is going to increase. It's going to increase from normal winter pressures. It's potentially going to increase because of a second wave of COVID-19. It's going to increase because of all the extra rehabilitation needs and mental health needs of people who've been affected by COVID-19. And really, that is quite a lot to be putting on a service that is trying to recover from what has been a really traumatic and unprecedented challenge.
Doctor, it's good of you to join us, Dr. Layla McCay. Thank you very much.